Hey guys, good morning. Okay, then start. It's still okay, I think we can start.
Morning, Doctor.
Okay, before I begin with today's class, do you have any question on anything at all? So I was informed by Glenn that you wanted your test to be Monday or something. It's not next week, right? It's another week. Second test, 14th of June. Okay, I'm fine with that. 14th of June, so okay, we can cover a few more topics until I haven't go through yet because I haven't make the questions yet, so I cannot tell you what this format gonna be. So most likely it's gonna be like similar with test one. It's just probably more images, more things to cover. Okay, if there's no question, I'm gonna start with the class today. So today's class, I will probably cover two lecture, okay? Because one of the lecture is gonna be quite short, and then I will top up with another. First of all is skin diseases. The second one is diseases that can cause drop in egg production. Okay, I'm going to start. Okay, the first one is skin diseases. There's quite a number of diseases that you need to know. Actually, for skin disease, quite a number of diseases, but there's a few diseases that basically usually much more common than others, and that you may or may not see. Okay. So first of all is fowl pox. This is very common. You may see if you work in poultry industry, you'll probably see this quite a number of times. It's quite common in Malaysia because in Malaysia and our climate, there's a lot of mosquitoes. We even have a seasonal mosquito season where not just fowl pox, we also have like dengue problem, all those things. Okay. So I've covered this before, so I'm not gonna cover this one. I just quickly glance through it, that you should know that you have a cutaneous form and blisteretic form, also known as the wet form. Mortality usually very low unless the bird get very severe where they cannot eat or see whatever the food. Okay, it's like in this case. Okay. Transmission is through direct contact. It's basically through wound and insect bites. We do have smallpox vaccine. Usually we do vaccination for smallpox for what is it? Long-lived birds. Okay. In broilers, we do it as well. We did practice smallpox vaccination as well. Only and only if is endemic in your region or where your area, you always get smallpox from. Okay. Okay, that's about it about smallpox. I've covered this before, so I'm not going to go through it again. Okay, the next one is gangrenous dermatitis, also known as necrotic dermatitis. It is basically a disease of young growing chickens characterized by necrotic areas of the skin by a severe underlying infectious cellulitis. So gangrenous dermatitis is quite easy to identify. Basically, when you look at the skin, it looks gangrenous. That's how it's self-explanatory. The occurrence, most outbreak in chickens around 2 to 20 weeks of age, usually happen in warm and humid houses. Then the etiology is similar with necrotic enteritis, Clostridium perfringens, but this one is type A. Yeah. Another one is Clostridium septicum and Staphylococcus aureus. Okay, these are the main etiology for gangrenous dermatitis. The pathogenesis is usually it starts off with cutaneous wound, for example, due to cannibalism or trauma. There's a nails in the farm or something that, and then the chicken somehow get injured on anything mechanical trauma. The bacteria invade and multiply in the particular area. Their toxin and metabolites causes cellulitis at the area. Septicemia and toxemia will happen and leads to death. Susceptibility increase if the chicken is immunosuppressed. Usually If the chicken just have a normal wound and something, they usually would be able to heal by themselves. But if their immunosuppressed is under constant stress and whatnot, so they are unable to clear up the infection and then leads to infections. Clinical signs and lesion, the sudden increase in mortality is quite commonly be seen, but it's not that high. Depressed and lame, scattered patches of gangrenous skin, extensive sloughing of the skin, subcutaneous tissue, wings and thigh. Usually it happen around the wing area and abdominal region. Okay, wing tips usually necrosis. You will see necrosis of the feather follicles. In the muscle usually underlying the skin lesion, you'll see it's quite discolored, edematous, and if it goes deep inside, you'll see necrotic tissue and darker patches of and congestion of the muscle. Actually, the muscle basically become dark because of infection. Liver, kidney sometimes get swollen and congested is usually due to septicemia. Bursa or thymus usually atrophied, but it's not because they get infected by this uh, bacteria that the bursa and thymus get atrophied. Usually the bursa and thymus are atrophied first, then only they get infected because they're immunosuppressed, then they get infected. So usually when you do postmortem, you'll find them together. But this is not the uh, manifestation of the infection is by the other etiology agents. Okay, this is how they look like. So basically on the skin, what you expect to see is dark region of the skin. Okay, it's like necrotic. It's necrotic. It's like gangrenous. That's why it's called gangrenous. It's like when you see, have you seen like diabetic patient when some part of their skin become gangrenous, it become dark and then it's fall off. Okay, this is how they look. It become gangrenous, it become darkened area at the abdominal region. If you open up the skin at the area that is infected, that's how they look like. The muscle it become darkened and edematous. See how you see it's fluidy, edematous and necrotic. If it happen in the leg region, it become swollen and dark. And it can happen at any places on the body as well. So this one is in the water area. Okay. You can also see under the skin is some at the wing area. Usually at the wing area. This is quite common, wing area. I just don't have pictures here. Wing area is quite common as well. Because wing, especially wing, if they live in what I would say, slatted floor. Okay, if they live on a slatted floor, sometimes the leg gets stuck, and then how they want to relieve themselves is by flapping the wing, and then usually the tip of the wing become injured, or sometimes they are born with splay legs or anything, and then the only way they want to move around is by flapping their wing. Okay, and then the wing get injured. This is the another region that is quite prone to gangrenous dermatitis. For diagnosis, based on history and gross lesions, okay, whether they are immunosuppressed, they're stressed, or something, whether they have problems with this before. And gross lesion is quite suggestive as well. Usually, when you see gross lesion, there's a lot of dark area, become gangrenous area, you should put gangrenous dermatitis on top of your differential. You want to confirm it, you can do smear of the or do some histology. You can do smear and then check directly. You reveal bacteria there. You can also do bacterial culture and isolation to confirm what bacteria are you dealing with. Treatment, of course, because this is bacterial problem, you can give antibiotics. Okay, next one is favors. It's not that common. It's not that common. It's due to Microsporum galinae, Microsporum gypsum, Trichophyton simi. They are basically fungus problem. White crusting or powder-like materials on the comb and wattles. On the comb and wattles, they're like powder. It's like someone have put like baking powder on top of it. Okay, it's like powdery. It looks like powdery. And then you'll see signs of hyperkeratosis, which is quite rare. The treatment, you can give tropical treatment for fungus, like nystatin, ketoconazole, whatever on it. But honestly, I've never seen this in poultry. And then even I've seen this, I'll probably not gonna treat topical treatment on every poultry or something like that. You can probably we just leave it go, leave it like that. And then some lesion may look similar, but if you do I mean in normal chicken, sometimes the wattle and comb they look like whitish, but there is don't confuse it with fibers. Fibers is a bit different. Okay, this is how they look like. So basically, it look like hyperkeratosis of this area, become crusty. But you don't confuse it with POTS as well. POTS is different. POTS is also hyperkeratosis. Not hyperkeratosis. Squamous cell metaplasia or metaplasia of the area, but it's different with spots because spots usually the lesion is black in color. Okay, but this one become whitish in color, and then you see all these powdery things. Okay, that's about it about fibrosa. It's not really important, and most likely you'll never see it anyway. Next one is pantothenic acid deficiency. It's a component of coenzyme A. Coenzyme A is quite important with a lot of biochemical reactions. If you have learned biochemistry, you probably know about it. Is it's involved in the citric acid cycle, synthesis and oxidation of fatty acid, and acetylation of choline and etc. The clinical signs when you see pantothenic acid deficiency is dermatitis, broken feathers, paralysis, poor growth, mortality, emaciation, crusty scab lesion at the corner of the mouth, okay, and eyelids sometimes stuck together with vicious exudate, similar with vitamin A deficiency. Postmortem, you'll probably see pus-like substance in the mouth, opaque green-white exudate in the proventriculus, spleens sometimes atrophied, and kidney can be seen usually large. Treatment, since it's a deficiency problem, you can just give oral treatment of pantothenic acid. You may not see it as often as well unless in pet birds. You may see this in pet birds, but in commercial poultry, usually is well formulated. You may not see this kind of deficiency. Okay, this is the last one. No, not the last one. Next one is sternal bursitis. Sternal bursitis is quite common. Okay, you'll probably see normally when you do postmortem in dead birds or in live birds, you can see this as well. It's also known as breast blister, breast burn, or breast button. Split-field lesions located at the ventral aspect of the keel bone because usually happen in older birds. Older birds sometimes you call not older but big birds, heavy birds. Okay, they are so heavy, their leg are wide apart. Sometimes they just sit down all the time. Okay, what happened is the keel bone get bruised and then become a blister. Okay. Sternal bursa due to repeated trauma and increase in size and become infected. This is the pathogenesis of it. Okay, this is how they look like. In the chicken, a heavy chicken with a nice breast muscle. Usually they sit down and then they usually sit on the keel bones, and then the repeated trauma, if they sit on the rough surface or anything, will lead to this blister. Okay, this is quite severe lah usually. Okay, this is quite severe. Usually it's not as bad as this one. Usually it only happen at this region, particular region, at the peak of the breast blister, keel bones. Okay, so this like this. If they get infected, then you'll see signs of infections. Okay, last one is ectoparasites. I'm not gonna cover in detail on this one as well because I think you have covered this in parasitology class, how the life cycle is, how the treatment is, and everything. It's just I want to introduce to you some of the common one. Lice is quite common, generally species specific, as is like usually the one affecting turkey only affecting turkey, those affecting chickens only affecting chickens, those affecting waterfowl affecting only waterfowls. Okay, in domestic there are quite a number of lice, and then even if you take um healthy chickens, you probably find some lice. Okay, that's quite common in any farm. So this one also usually goes underdiagnosed. We don't really check for lice in chickens unless they actually we have done they didn't grow so much. Okay, they didn't grow well. And then we have done a lot of infectious diseases. We have covered everything. For example, anything that can affect the growth uniformity, why they become pale or anemic or anything like that. And then we check for all other things, for example, chicken infectious anemia, whatever, and it goes negative. And then only maybe you check for lice if the lice infestation is too bad. Okay, this is some example of the lice. Okay, you may not have to memorize all this. Okay, you may not have to memorize it, but you just have to know that it exists because lice quite a number of times. There's some of this is quite common than others. Okay, they feed on scales on skin and feathers. Life cycles approximately about 3 weeks. Will die 5 to 6 days when separated from the host. Usually they live on the host. Okay, controls. I think you have learned this in parasitology class. You can use parathrin, parathroid, carbamates, or organophosphates to treat the lice problem. Okay, this is how they look like. However, in lice, we have seen lice, heavy lice infestation in pet birds. Okay, that one definitely you have to treat lah. Okay, if you have to treat in pet birds or in a small farm. Okay, like village chicken or something, then that maybe you can treat it. So that's how they look like. All these white things actually their eggs. Okay, it's so bad. So their eggs. I've seen a very bad lice infestation in some not a farm, a sanctuary, a bird sanctuary. Okay, that one we have to treat. That one is mites. Okay, it's very small. Usually you cannot see it with your bare eyes. It's not host specific, so basically they can infect from one host to another. They feed on the blood, feathers, skin, or scales. Some mites do not spend entire time on the host. Does need to treat an environment. It's quite quite different from the lice just now. The lice usually, like I is stated here, will die 5 to 6 days when separated from the host. Mites, however, they can live in the environment quite a long number of time, prolonged period of time. So you may want to treat the environment if you want to totally eliminate the mite issue. There's quite a number of mite that you should know, and there's only a few of them are well known to cause problem. Then so you have to know all this one. Okay, common mites are chicken rat mites, northern fowl mites, especially a big problem in USA. Depluming mites and scaly leg mites. Scaly leg mites is the thing that you probably will see quite often. Okay, you'll see quite often, especially in pet birds. Okay, in pet birds, you may see this in poultry as well. Okay, may see this in poultry as well. But we have quite a number of issues with scaly leg mites brought in to our UVH with scaly leg mites. Basically, the appearance is quite characteristic. Basically the leg becomes scaly, become hyperkeratosis on the area. This is some of northern fowl mite infestation. How do you know whether the chicken have mites or not? Usually when you see on the skin, they have a skin area where it become darker. It looks like someone spread what do you call it smoke ash on it, ashes on it. Also, this is like all this dust that remnants produced by. You cannot see the mites per se, but this is what if they get infected. This is how they look like. At the coracle region, see how it become darker and it become powdery like that. This is how scaly leg mites look like. Okay, they become scaly. This is not so severe. This is so bad. Okay, they become hyperkeratosis or this area. Scaly legs. Okay, so usually we don't really diagnose this in the farm as well unless you notice that your farm has a very big problem with anemic problem, and then the birds looks depressed because mites can cause a big welfare issue. It cause irritation and it's itchy. Okay, so the bird become restless. The bird become restless. You may want to treat it and treat the environment before you bring in new chicken. Okay. Okay, this is how they look like. Okay, and there's others also. You can have ticks. This is I went there in one of the sanctuary, bird sanctuary or something. They have big ticks on the feather on this peacock. Not just ticks. This particular peacock, they have few peacocks at the around. I went there with few from. It's like literally like the whole body is infested with ticks and lice. The moment you touch the peacock, okay, the moment I touch the peacock and some of the DBM5, all the lice crawling on your body. Okay, it's like they crawling on your body. Okay, so you can feel like all this lice crawling. Okay, this also flea. Chicken can also get infected with flea. You know the difference, right, between flea, ticks, and mites. All those things. I hope you know because you already did VM3. You have covered in parasitology. How they look like, the flat, how the flat everything. Okay. Okay, this is the flea. Look at the face here. Yeah. The severe case of flea. Okay, in pet birds, what we did is we just spray with what's called this spray. It's the same one as for cats and dogs. I forgot what spray is that. And then you just put it on you spray on paper towel and you wipe it all over their body. Okay, that's all about skin problem. Do you have any question? I probably have one question. Okay. Doctor, I might have missed it out, but how does gangrenous dermatitis causes bursa and thymus atrophy? Uh, how does gangrenous dermatitis cause bursa? I think I've mentioned it just now. Okay, probably you missed it. Gangrenous dermatitis does not cause bursa and thymus atrophy. So, but usually seen together because gangrenous dermatitis usually happen in immunosuppressed birds. So, immunosuppressed birds usually they have bursa or thymus atrophy. It's not because gangrenous they get infected then they have bursa and thymus atrophy. Usually they have bursa and thymus atrophy, then only they are prone to this infection. Okay, because they cannot clear up like this. Because Clostridium prefringens, Staphylococcus is something like quite, I wouldn't say normal flora, but it's something that you can isolate in the environment. And then the bird usually resistance to it. They just clear up the infection. When you have infection on the skin or something, you just clear up. Unless the bird is immunosuppressed, then so bursa and thymus atrophy usually atrophied. It's not because it caused by, but usually this is the reason why they have the gangrenous dermatitis problem. Okay, I hope you understand. Tanzian, suddenly frontline. I don't what is that the question? Oh, frontline. Oh, okay. You're talking about the spray, yes. Frontline spray. I thought you're talking about frontliners. Okay. Um okay, next one I'm gonna cover diseases that cause drop in eggs production. So we still have 30 minutes. This one also is only 27 slides and that is very fast. Because I've covered most of the disease in previous lectures, I'm not going to cover it again. Okay, when it comes to diseases that cause drop in egg production, basically almost all disease can cause drop in egg production because when the chicken get infected, the chicken becomes stressed, and then when they become stressed, they reduce in egg production. However, some diseases affect them directly. When they get infected by this, you will definitely see drop in egg production. Okay, you get infected by this, you'll get definitely drop in egg production because somehow it affects the reproductive systems. Okay, and then you have to differentiate between drop in egg quality and drop in egg quantity. Okay, drop in egg quantity, like I said, almost all disease and then whatever listed here can affect egg production. Okay. However, only few diseases affect egg quality. Okay, only few diseases affect egg quality. Egg quality, I'm talking about the quality of the egg that is being produced is not good. they become a shellless, soft shell eggs, discolored eggs, or something that is something that you cannot market it. Okay, you cannot market it. Drop in egg production is okay. It reduce in egg production. However, whatever eggs they produce, you can still sell it because it's normal egg. It's just reduced in production. Instead of 90%, it drops to 60% production. Okay, you can still sell the 60% production. However, some diseases they affect egg quality. On top of egg production, the one that they produce also are of low quality. So only few diseases affect egg quality. This is some of the diseases I listed here: egg drop syndrome, infectious bronchitis, avian influenza, Newcastle disease, and avian metapneumovirus. Okay, mycoplasmosis also can cause affect egg quality, but not so much. They not affect quality per se, but they can produce an egg that is quite unique. But I'll show you after this. Egg drop syndrome. Okay, this is quite an important disease. It's egg drop syndrome, first reported in 1976. That's why they call it EDS 76 in some literature. Characterized by healthy birds producing thin shell or shellless egg. So that's what happened. Okay, it affect the quality. They become, like eggs have two layers, right? In the layer, they have a membrane. On top of the membrane, they have shell. If you boil an egg, after you remove the shell, and then you say there's a membrane inside there. Okay, what happened in this when they're infected with egg drop syndrome? They only have the membrane. They don't have the shell. Failure to achieve production targets and affects only avian species. There's no public health significance. You can eat the eggs, so no problem. The etiology is adenovirus, probably introduced into chickens through contaminated vaccines. Virus often remain latent until birds approach peak egg production. Natural host is waterfowl or ducks and geese. Okay, usually waterfowl are the natural host of this virus. And then even if you want to isolate this virus, you want to grow it in duck and geese eggs. Okay, duck and geese egg because they are the natural host. The transmission, vertical transmission and horizontal transmission. However, vertical transmission is much more important because if you want to reduce the chances of vertical transmission, or else you have to cull the breeder, the grandparent stock, everything. Horizontal, direct or indirect contact with infected wild or domestic waterfowl, transmission between chickens, flocks, but usually not usually a features lah. Okay, the important one is vertical, especially if you are breeding grandparent stock, or if you are breeding grandparent stock lah, grandparent stock actually. If you're breeding grandparent stock, you will produce parent stock, and then if you affect the parent stock, which is the layer, not the parent stock, the parent stock. If you parent stock is for layers, and then the layer will have problem. If a breeders parent stock for breeder, and then the breeder will have the EDS problem. Incubation period is about 1 to 3 weeks. Clinical signs: at first, you'll see loss of color in pigmented eggs. Okay. For those who live in Malaysia, you have never been out of country. You probably probably rarely see white eggs. Okay. Probably see white eggs because in Asian countries, basically, we consume brown eggs. Okay. However, in Western countries, they consume white eggs. Okay. Okay, so in white egg it's a bit difficult to appreciate this one. In Asian country, you can appreciate this one because our brown eggs become white eggs, followed by production of thin shell, soft shell, or shellless eggs. Thin shell eggs often have rough sandpaper-like texture or granular roughening of shell at one end. Outbreak usually lasts 4 to 10 weeks. Egg production can be reduced up to 40%. Failure to achieve target egg production, onset of lay may be delayed, and affected birds remain otherwise healthy. They look okay, it's just the egg become a problem. This is how they look like. Okay, the shell become fragile. Okay, this is the normal one. Okay, it's the normal one. Maybe not normal also. It looks rounded. Okay, this one is like shellless egg. This is only membrane ataupun thin shell. We call it thin shell. Or this is shellless. They don't have shell at all. Like membrane only. This one is thin shell egg ataupun soft shell eggs. Okay, this also soft shell eggs. This one is like no albumin. Okay, they don't have albumin. They produce eggs and then there is like crumpled. These are all came out from the chicken. If you go to farm that are affected with diseases that can affect egg quality, is quite interesting because as you walk along the way, the hallway to collect eggs, you'll see different kind of eggs. And then it's quite interesting to collect different shapes of eggs. Some is long, some is rounded, some looks like bowling apa tu? Bowling bowl, what is pool, all those things. Okay, it's quite interesting and the shallows. Postmortem lesions. If you do postmortem in those affected with EDS, you'll see inactive ovaries. What does it mean by inactive ovaries? Usually, when the birds, okay, the birds or layers or hens reach maturity stage for them to produce eggs, they're supposed to have 5 to 6 active ovary at one time. Active ovary means like egg yolk. They should have an. I don't have picture. They should have a lot of egg yolks inside the chicken because chickens basically produce eggs almost every day. Okay, they produce eggs almost every day. And then I hope you know your anatomy, your anatomy for reproductive system. I'm gonna ask in the exam. Okay, so the infundibulum will catch the egg yolks every day, and then they transfer it to and then put albumin, put shell, all those things. However, those in affected with EDS, they have inactive ovary. Basically, if you do postmortem, there is no egg yolk. Or the egg yolk become all these small clumps of ovaries. Small clump like grapes, like but it's very small. It's not ready. It means like if you look at it, you know that the chicken will not produce egg for quite a long time. Okay? Atrophic oviducts, mild splenomegaly or flaccid ovules, eggs in various stages of formation in abdominal cavity. What does it mean is sometimes the eggs didn't get released. Okay, they fall inside the abdominal cavity. Okay, they accumulate inside that. Histopathology, virus replicates in epithelial cells nuclei producing intranuclear inclusion body. This is adenovirus similar with what is it? Inclusion body hepatitis. Adenovirus have characteristic of inclusion body. So if you do histopathology, you may want to look for intranuclear inclusion body. Diagnosis, clinical signs, and postmortem lesion. Clinical sign is quite obvious lah. Egg drop syndromes, all those things. Postmortem lesion, like I said, inactive ovary and other, you should suspect this. Isolation, identification of causing agent. You take the sample, you isolate it, inject into embryonated ducks or geese. Okay, because ducks and geese are their natural host, so the virus will grow well in duck and geese eggs. So in duck and geese eggs, you can also grow in cell culture of duck or goose origin. You can also do serology, HI or ELISA to confirm it, or you can also do PCR. Okay, prevention and control, good management practice, and also vaccine. Okay, vaccine against EDS is highly effective. Okay, that's why you may rarely see EDS issue in layers of breeders nowadays. Okay, this very effective. Okay, all adjuvant inactivated vaccine 14 to 16 weeks of age. Next one is avian metapneumovirus. I'm not cover AI, ND, all those things, but I have covered that. Okay. Next one is avian metapneumovirus. It's highly contagious infectious respiratory disease of turkeys and chickens. Actually, avian metapneumovirus should also be listed under respiratory disease. Okay, I forgot to list it down. Avian metapneumovirus should be listed down under respiratory disease also. Highly contagious infectious respiratory disease of chickens and turkeys, also known as turkey rhinotracheitis, swollen head syndrome, or avian rhinotracheitis. The etiology is avian metapneumovirus. is enveloped single-stranded RNA virus, member of metapneumovirus of Paramyxoviridae family. Natural reservoir is turkeys and chickens. The transmission is through direct and indirect contact. In young turkeys, you'll usually see nasal discharge, foamy conjunctivitis, swollen infraorbital sinus with submandibular edema, and mortality can be very high. Okay, 0 to 80%, usually due to secondary infection. And turkey breeder hens decline egg production 10 to 30% and increased number of cull eggs due to affected egg quality. In chickens, okay, in turkeys, usually the signs is much more severe. However, in turkeys, it's not that bad. You will have swollen head problem. And this is how chicken swollen head. Basically, the head swollen head syndrome. Egg production problem. The pathology, if you do postmortem, in female turkeys, you will see increased eggs with poor shell quality, peritonitis, and uterine prolapse, watery mucoid nasal discharge, and if they get infected with secondary infection, you'll see asaccharitis, pericarditis, perihepatitis, and pneumonia. In chickens, what you expect to see is swollen preorbital and infraorbital sinuses and inflammation of the upper respiratory tract. Usually in chickens, it's not that bad lah. I mean, just swollen and that's all. And affect egg quality. Okay, this is how they look like in turkeys. This is the turkey. Okay, see how the preorbital sinus is swollen. Okay, this is the cilia. This is immunohistochemistry. The brown one is the virus. The brown one is the virus. So the virus affected attached to the cilia. For diagnosis, you can do history based on the history and signs. Isolation is slightly difficult, but you can do immunohistochemistry on formalin fixed turbinates tissue. It's like this. Okay, immunohistochemistry. You see the brown one is the virus to visualize the virus. Immunohistochemistry on formalin fixed turbinate tissue. Real-time PCR to detect, not real-time PCR. Reverse transcriptase PCR to detect viral RNA. And you can also do ELISA. ELISA sometimes is not as useful because metapneumovirus has been said that it's quite endemic, but it's not always causing problems. Sometimes it's just there. If you do ELISA, they can become positive, but doesn't mean the chicken will produce any signs or problem. Control, biosecurity, and good sanitation, as usual. Live attenuated vaccine available in mid-western USA. In Malaysia, we don't really vaccine against AMPV also. It's something that always goes underdiagnosed. Nobody doing research of avian metapneumovirus also in Malaysia. But I believe it is quite endemic in Malaysia. There is no data on metapneumovirus in Malaysia. Routine monitoring for areas where avian metapneumovirus has been a problem, serology and PCR for control. Okay, that's all about avian metapneumovirus. Next one is hepatitis E virus. It can cause hepatitis splenomegaly syndrome in both layer and broiler type chicken. It is characterized by increased mortality and decreased egg production. Also known as big liver spleen, necrotic hemorrhage, hepatitis, all those, and a lot other you don't have to remember. You just have to remember is hepatitis E. Okay? If you put hepatitis E infection, it's also correct. Okay? The etiology is hepatitis E. It's a spherical non-enveloped single-stranded RNA virus under the family of Herpesviridae, genus Herpesviridae. Transmission is usually through fecal-oral route. The clinical sign is non-specific: anorexia, depression, pale combs, wattles, and soil vents. Some birds die suddenly with no signs. Morbidity and mortality usually low. And then what you'll see is egg production drops up to 20%. Small eggs with thin and poorly pigmented shells produce in affected flocks. However, the internal quality, fertility, and hatchability of eggs are unaffected. The lesion you will see as this is a hepatitis problem, you may want to see at the liver. Okay. Hemorrhages in abdominal cavity or on the livers, red fluids in the abdominal cavity, liver become enlarged, friable, and mottled. Spleens can be severely enlarged and mottled white. Ovaries often regressing. Histology, you'll see extensive hepatic necrosis and hemorrhages. exfiltration of lymphocytes in and around blood vessel in the liver. So this is how they look like. Okay, the liver become yellowish. Sometimes you see hemorrhages in the abdominal cavity, or they get yellowish in color, and then the spleen become enlarged, huge, or twice or three times the size, the normal size, and become more bloated. The diagnosis based on clinical sign, gross and microscopic lesion. When you see drop in egg production and you do postmortem, you'll see liver lesions. Okay, you can do isolation, grow it in chicken egg embryo, in vivo, in vitro, immunohistochemistry, serology. You can do ELISA or agar gel immunodiffusion test, and we can also do PCR for hepatitis E problem. Okay. This one also, I've never seen hepatitis. I've never diagnosed hepatitis E in Malaysia, but I think it could happen because usually it underdiagnosed, and then sometimes it's a bit difficult to diagnose because it can be confused with a lot of things. For example, fatty liver, kidney hemorrhages problem, or inclusion body hepatitis, and always goes underdiagnosed. Even um, diagnostic labs also, not many labs can do diagnosis for hepatitis E. They don't have the kit for serology, and they don't even develop PCR, standardize the PCR for hepatitis E. So it often goes underdiagnosed. I think it's here. Okay. Control is biosecurity. A vaccine against avian HEV or mammalian HEV is not yet available, same as in human as well. Okay. Next one is egg apex abnormalities. Okay, I just want to talk a little bit about egg apex abnormalities. This is a lesion quite specific for Mycoplasma synoviae. EAA, apex abnormalities lesion, has been associated with gill infection of hands or viduct by certain strains of Mycoplasma synoviae, resulting in the production of abnormal eggs. They, in some experiment studies, have reproduced the condition by infecting laying egg with IB and certain strains of Mycoplasma synoviae. So what happened is they have a unique appearance. Okay, it's not similar with other what do you call it, reduced in quality eggs. Okay, like I've mentioned earlier, in other eggs they become soft shell, colorless, shellless, or something like that. But in egg apex abnormalities, it only affect the egg apex. Okay, at the pointy side of the eggs. Okay? If you collect the eggs, if you go to layer farm or breeder farm, you collect the egg, and you notice that the one side of the eggs looks gritty. It's like rough surface. Okay, then you may want to suspect this. It become like this one, gritty. Okay, severe one, they have it cracks a bit, or it damp down a bit. Okay, so that's how they look like. It's quite unique, but for this one, it just control Mycoplasma. I just want to tell you, you may see this. Okay, I think that's all on the diseases that cause in egg production. I'm not going to cover because the rest of the disease I've covered in previous class. Check. Okay, I don't have any. Okay, any question? Okay, another thing, like probably one of the things that can cause egg production I didn't list it here is heat stress, heat stroke, heat stress lah, basically heat stress. It somehow can also affect egg quality as well. I've seen when the chicken are bred in very hot temperature or something. Sometimes the egg quality a bit I think it has to do with metabolic problem, because when the chicken are hot, they tends to hyperventilate. When they hyperventilate, it cause acidosis, and the acidosis can affect the metabolism and affect the calcium. Okay. Any question related to these two topics? Okay, I think it is quite straightforward. Okay, but it's quite important, especially if you are going to work in layer farm or breeder farm in the future. Drops in egg production is something that you don't want to happen because it can cause huge losses. Huge losses. Okay. Okay, that's all. No more question. If there's no more question, I think that's all for today. Have a good weekend. I'll see you next week. So next week there'll be 2 more class. I think I can finish some more lectures. The plastic diseases, toxicities, immunosuppressive diseases, disease of ducks. Okay. With that, that's all for today. Thank you very much. Stay safe, everyone. See you guys.
Thank you, Doctor.
Thank you, Doctor.
Thank you,
Thank you,
Doctor.
Doctor.
Thank you. Get vaccinated.